last class. Now, joints. I'll be going through all types of joints and then different types of joints. And as you proceed, say now your superior extremity, your lectures are going on, dissections are going on. Whatever is going on, your dissection, everything in the demo room, the skeleton is there. You see it as a composite. The different types of joints, whatever in the body, you see it in the composite. Then when you ask Suresh, when the bones are being demonstrated, then you take those bones and try to group study and see the components of the joints. Now you'll be the sternoclavicular joint, acromioclavicular joint, then shoulder joint. These all the joints, okay, in the superior extremity. Then you come superior radioulnar joint, inferior radioulnar joint, then the carpal bones, interphalangeal joints. And as you are going on in the superior extremity, it is the same, more or less same, the lower limb. That's why superior extremity, then lower limb, then abdomen, then thorax, then head and neck, and skull, brain, and next year you'll be, by this time you'll be sitting for the exam. Okay? Now, joint is the union of two or more skeletal elements, bone or cartilage. Now, joint. So, two elements are required. Like you are joining hands. Okay, that means two persons are involved. Now, similarly, it's a bone or the cartilage. Now, chief function of joint is determined by the type of tissue of which joint is constructed. Now, the chief function of the joint is determined by the type of tissue which joint is constructed. Now, you see the sternoclavicular joint or your sternum with the ribs making the thoracic cage. Now, if in the posterior end, the ribs are on the vertebral column. Now, it's a inspiration, expiration. You take a deep breath, expand. Now, there is a movement. The ribs articulating with the vertebra. There are small joints with the vertebral processes with the rib. And that is 11th and 12th is the floating ribs. Anteriorly, it is not extending up to the sternum. Okay? Now, in great majority of free articular surface slide, spin, or roll over one another. There is being other tissues interposed between them. Movement in such joint is facilitated by lubricant called synovial fluid called synovial joint, diarthrosis. Now, you see, you have seen the humerus, scapula, clavicle. Now, see the humerus and the granodal cavity of the scapula and the upper end head of the thing, it articulates. Now, you just swing your hand like this. Now, you can see, you can go like this. But the limb, lower limb, the hip joint, you can kick, you can go up to that level in doing acrobatics. If you can put up your leg, that is restricted. Because the elements, the components of the hip joint, the anatomical disposition of the pelvic bone and also the femur being articulated in the and like you're riding a bicycle. Now you're in the chain, you have to put some oil. Similarly, there is the lubricant known as synovial fluid. Now, at times, suddenly a person comes with a swelling. It can be traumatic, it can be inflammatory. So, there's a swelling. Now, you have to ask that, আপনার কি আঘাত লেগেছিল? পড়ে গেছিলেন? So, that will be a different presentation. Now, if it is a tubercular arthritis, then there will be a swollen knee, a swollen shoulder, then rheumatoid arthritis. Come. Now, rheumatoid arthritis, the small joints swollen up, movement is restricted because the space is taken up by the fluid. Now, one thing, say the fluid, the post-traumatic synovitis, then inflammation, the total process of inflammation, that leads to the excess secretion of the fluid. If it is traumatic, so you can do one thing, is that the fluid, the synovial fluid, you just aspirate and send it for microscopy. And the fluid can be sent for your other biochemical tests and also for the common tuberculosis. So there are lots of tests there, TB, PCR, as you go on, you will be learning. And if it is a hemorrhage, then you can see this hemorrhage as post-traumatic. Now, similarly, in remaining non-synovial or synarthrosis, there are no free surface and connective tissue of considerable strength unite osseous surfaces. Such an arrangement precludes movement, although some angulation and distractions are occasionally possible. It helps growth and may permit molding during childbirth. Now, you see the skull of the baby, fetus. The other day, I showed you that the skull of the bone. Now, during the process of parturition, normal delivery, then it happens that it goes, the uterus, the cervix expands, and by your part vaginal examination, a lady comes to your emergency obstetrics department, then you do a PA, you ask her from what time the pain began. You might say 6 a.m. or yesterday 6 p.m. Accordingly, you have to see and gauge the pelvic with your vaginal examination. Now, you have to see if the cervix is thinned out. Now, accordingly, now the head, you see if there's enough space or not. So when you see the hip joint, then all child which comes is born is will be normal delivery. So this assessment is such that